Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Well, Rich, all good things must come to an end. I'm afraid today is the day in which I finally get a pandemic haircut and shave off my face muff. So mark the date. It's been a fun run, but this is the official end of the pandemic, I believe. As soon as I shave, it's over. Or wait, I'll go back to normal.
Okay, I think of it as a beginning rather than an ending. Maybe it's the beginning of the next pandemic.
Could be. Maybe I'll call this mass hysteria by shaving off my face.
But only if you have a conversion disorder first.
I think we should move on to a mental wealth tip.
The mental wealth tip of the day. What you are not, here's the mental wealth tip of the day. What you're not ready to perceive or accept in yourself, you may project onto other people. So be careful.
Wow, what an on-point mental wealth tip.
They're all perfect. They're all very treasured.
They're all on point, but they're not always like the most perfect segue into our show, which is
a pretty good one. It's a pretty good one on
conversion and mass hysteria.
I like this topic. I thought it was cool.
Dogs and cats living together. Mass hysteria.
Yeah. Well, we live mass hysteria, I think.
We were talking about nomenclature. Why? I don't know. It's just sort of an obligatory part of the intro of every one of our shows. But, we were teasing out, hey, what's the difference between conversion disorder and mass hysteria? Did you know it was also called Mass Psychogenic Illness, epidemic hysteria, mass sociogenic illness, mass psychogenic disorder? A lot of mass and a lot of psychos.
It's a story of our lives, Mark. A lot of mass and a lot of psychos.
And I think it's important to know currently, and as far back in my training and probably yours, it's been a type of a somatoform illness. And a somatoform illness is one that I like to translate into, hey, mind-body connection. Wow, this is like some real nuts and bolts. It's one thing to sit out there and like hooey and believe in myself well. It's another thing when you have hard evidence staring at you showing, hey, there is a mind-body connection and it is clear and present, powerful, mimics serious illnesses. It's not a neurologic disorder. Like neurologists, people always say, hey, what's the difference between neurology and psychiatry? My explanation, they would probably hate it, but they generally don't like psychiatry in general, is neurologists are looking for lesion localization. So in the hardware of the brain, they're interested in hardware. Now there's two fields in between psychiatry and neurology, behavioral neurology and neuropsychiatry, but they really only exist on the academic level. And so neurologists are looking for an infection or an injury in either the brain or the spinal cord, basic lesion localization, whereas psychiatry is interested in everything else.
I just like people to feel better.
That too. So I guess
now you got to remember that my training started in the ancient days before yours did, and conversion disorder was a big deal, because it was a couple of diagnostic manuals ago, and so we got a lot of alternative psych training on conversion disorder. No, seriously, it was a big deal. And the idea that you could have what seemed to be a physical symptom that had no physical underpinning was pretty impressive idea. I think it was to Freud too.
Well, yeah, we're definitely going to talk about that big cheese. And I brought audio-visual support over here, my action figure. Which I know you have one as well.
I have one, but I have lots of them.
And I kind of liked your definition, honestly, a little bit better than mine, but I'm going to go with mine because it's in front of my face and yours requires me to like click on a mouse and stuff.
Go for it, man.
I'm kind of low energy, but typically what this means.
You don't seem low energy to me.
Is it's the rapid spread of an illness, usually neurologic in nature, but it can be sensory motor, and it affects members of a specific group, usually a cohesive group, often a repressed group. We'll talk a lot about that, but it originates from some sort of nervous system disturbance, which is either through excitation, loss, alteration of function, and that you get these signs and symptoms that are very clear, and they seem to actually even spread, but they have no corresponding organic etiology, at least that we can determine yet. And yeah, like you mentioned, Freud was extremely interested in this because he thought this was intimately, and I think accurately, tied to the unconscious, which is the mind-body connection here.
Well, the idea that there's a conversion symptom, there's mass hysteria. Mass hysteria goes back way before Freud.
The beginning of humanity, as far back
Really,
as recorded history.
and conversion disorder, and it used to be, I think it used to be called hysteria in the first diagnostic manual. I don't think it was called conversion till later. Maybe,
Right.
I don't know. I didn't read the first one. I started with the third one. Um, but the idea that you could have conversion disorder in one person and you could have it in like 500 people, that to me is fascinating.
It is fascinating. And it, like you mentioned, Freud, and, Freud is one of many historical features that I respect and admire, and I recognize their great contribution to the field, but they were also, um, human beings and fallible, and usually later in their career kind of go awry. I mean, we've talked about his penchant for cocaine, or Hitler and his amphetamine psychosis and going bonkers in general, or
Yeah,
Tesla in the early years versus
I
later in his
think
life,
I
or
think
even
Jung had a few blips too.
Young, definitely.
Yeah, yeah.
But Freud, this was so powerful. Freud, a lot of people still don't know this. Freud was a neurologist. He was primarily a neurologist. He was trained in neurology, and neurology at that time arguably had a little bit more association, I guess, with what we would recognize as psychiatry. But it was still, in a lot of ways, very similar. Of course, the science was burgeoning and evolving, and not really recognizable in the way it is today. But he literally made a break, right, from neurology. And I kind of relate to this because my dad was a neurologist. I think like an engineer and a neurologist. I was very interested in neurology, but boy, I was off to the races when I started thinking about behavior. And I kind of feel that kinship, maybe like what Freud felt, where he thought, whoa, what is going on here? I know neurology and I can't explain this. And ultimately, this is what some people believe led to his theory of psychoanalysis, and got him later kind of into what we would consider psychiatry.
Well, I have a friend who's a local doctor who is fluent in German, and he read Freud's original German, and he said that it was kind of mistranslated, that Freud was far more biological and physical than it came out to be. Now, this makes sense because his daughter, Anna Freud, became the head of the Psychoanalytic Association.
Society,
She
yeah.
was not a medical doctor. So she pushed it more into the psychology. I think Freud was far more, I actually do agree with that Freud was far more biological than they give him credit for.
Yeah. Well, we got a ton of examples, and we talked about these examples. There are so many examples of conversion disorder, mass hysteria.
I ran out of paper. There was so
We,
many.
we, we both ran out of paper, but I want to blister through a lot of them to really just drive the point home. Plus, a lot of these are,
Before you give the examples, let's talk about the symptoms first, so people know what the hell
well,
we're
yeah,
talking
that
about.
was my lead in here.
Oh, okay, go for it then.
So, I mean, and then there were a couple other things, like some of the epidemiology of it. What we do know about at least the epidemiology of it is, one, it's been around forever. Two, it does tend to occur in the cohesive groups, or in areas where there's societal oppression, or social conflict. It showed its head in, a lot of times, in textile factories, nunneries, very common in nunneries, schools, particularly Catholic schools, sorry to pick on them, on the battlefields, areas, or it was initially thought it was some sort of a cultural phenomenon. And you could see why with the gift of hindsight. We know adolescents are more affected and children than adults, and we know women are far more affected than males, which is interesting as well. I think it shows that they're probably more empathic or wired more empathically. And one hypothesis says, hey, these people are prone to extroversion, or what I guess Freud would have called neuroticism. There is some suggestion that it occurs in people with lower IQ scores. I don't know what to make of that. I don't know if I intuitively agree with that, but that's interesting.
Well, I think it depends if you go by the strict definition of conversion disorder in the diagnostic manual, or sort of the more colloquial idea that a mind-body illness that you can't explain from physical, like chronic pain. They don't consider that a conversion disorder, yet I work with it every day. And there's no doubt that when I deal with the emotion of it, the pain decreases. So, I mean,
100%.
so would that qualify? I don't know. In my world, it does, but not in the diagnostic. What's that?
That's how you use the force to heal.
Live long process.
Peace and long life.
That's right.
Let's just go ahead and get the audio visual support.
Okie dokie.
Woo! Thought I'd never get a chance to play with these guys.
I got Freud too here.
Oh, gentlemen, settle down. Okay, we'll just keep him right here.
Where did he go?
While you're looking for that, I'm going to explain the exact...
I got this guy here. He's a wizard.
The wizard. The exact mechanism as I could best conceptualize and explain it to the masses in hopes of provoking mass hysteria. Just kidding.
We don't have to provoke mass hysteria. It's already there.
You don't. That's true. But here's how we think it works currently.
Cool.
This is subject to change tomorrow, by the way. So there's a subconscious attempt to convert a strong or unbearable emotion, intolerable, repressed emotion. Sometimes it's a sexual urge, which we know Freud talked a lot about, into something more socially acceptable. Okay, that's interesting. But if I'm having an inappropriate sexual thought, what is it? Can start as a tic. We don't totally know that, but we know this is where it gets really weird and exciting. We know that it's transmissible, right? From one person to another. So it can reinforce the behavior of another, whether that's through suggestibility. We could pontificate on that all the while, but we do know it tends to be more culturally or geographically specific. And if there's a shared common set of beliefs, or the same people, like in the high school example we'll talk about up in New York, that have similar anxieties and fears, then that's the ripe environment for a breakout or an outbreak, was really what these are. Yeah. So are you ready for some examples?
Well, I want to do symptoms first, so people know what let me just read them off. Weakness or paralysis, abnormal movement, tremors, difficulty walking, loss of balance, difficulty swallowing, seizures, episodes of shaking, apparent loss of consciousness, episodes of unresponsiveness. Actually, Freud's original one was anesthesia, like the person wouldn't have any feeling in their hands.
Yeah.
I would add chronic pain to that, but that's not in the manuals. I just seen it so many times. So now you can go into the next step, Mark.
Well, and maybe to elucidate your point even more, other features of the outbreaks is that obviously they are heavily studied, and there never is a plausible organic etiology identified. They are transient and benign symptoms, even though they can look horrific. They have a very acute or rapid onset, and usually a rapid recovery. Although the New York example, which a lot of people actually didn't even hear of, which is interesting, there were a couple of people that lingered on with that one. Again, It occurs in segregated groups, extraordinary anxiety or stressors. Symptoms are spread via sight, sound, or oral communication. Moves down the age scale, like we said, the kind of younger or adolescents and females most suggestible. And yes, many of the examples throughout history involve at least conversion disorder requires by diagnosis a neurologic sign or symptom, but mass hysteria and what we were talking about, the group
Groupthink.
yeah, groupthink is,
Well,
which we
when
can
I was a
define.
young student, I mean, we actually were talking a lot about this, and what I was told was that if you get glove anesthesia, meaning that the anesthesia stops here, that's conversion. If it goes to here, that might be neurological because it has to do where the nerve endings are. I don't know. You're the medical doctor, but it made sense to me. So
I like
whatever.
that. I like that example.
Well, because
Um,
it gives you a sense of when you really have to look at an emotional underpinning and when you need to look elsewhere.
yes. And this is an area of Western medicine and even psychiatry and psychology that we are, in my opinion, still failing miserably and missing the boat because it has such, even if we don't understand the etiology, there is such a powerful um, opportunity for healing that it really seems like a great disservice to society to not understand this better. But like I said, all the research goes back. The Greeks talked about this, the earliest recorded history. We know this has been part of humanity, but we'll fly through these because I'm hoping some of the viewers have heard of some of these because they're around us all the time and they seem to occur about every 5-7 years. But as the world gets bigger and stressier, we're going to see, I think, even more of it. But
Especially as more things get reported.
more things get reported, we understand them differently. The dancing plagues of the Middle Ages, these people really had no context in understanding it. A lot of them thought it was curse or witchcraft, sorcery. They called them dancing plagues because a lot of times people get these what's called choreoathetoid movements, or choreo, I think, means dance in Greek. Um, and they can get tics or grimacing, which is very Tourette's looking like on conversion disorder. Um, Dancing mania, they used to call it, as early as the 7th century. Of course, the Salem witch trials, a lot of people have figured that was, of course, at the time they thought it was demonic possession, or sorcery, witchcraft, but a lot of people agree now that was actually probably not even an environmental exposure like ergot, poisoning. It was probably a conversion disorder, which is interesting. And specifically St. Vitus dance. If you've probably heard of St. Vitus dance or St. John's dance. These were saints that were accused of projecting this mass hysteria, this conversion disorder, because of an evil spirit, which I thought was interesting because it's kind of like, wait a minute, shouldn't the saints be the ones you go to exorcise the demons? But
Maybe
hysterical blindness,
they take them on for you.
that one's a really interesting one. You and I both worked in the VA, and I don't know if Vietnam PTSD looks different to me than World War I PTSD. It looked more severe. I think, we've talked about, you and I know the difference between chronic PTSD and an acute PTSD, but what they used to call shell shock,
Right.
had a feature of conversion to it. They called it hysterical blindness, and this is where soldiers were so upset by what they were seeing, they literally went blind temporarily, and until they were in kind of a safe place, like in a hospital, and then their vision would suddenly return.
I have
That is a
a
conversion.
question for you. I worked with a tennis player once who's she had a shoulder injury and the physical therapy wouldn't work. And when she got to me, I said, "Well, what's on your shoulders?" And she says, "Well, I have to make money for my whole family. No one has a job. I'm supporting my whole family." I said, "Well, how do you feel about that?" She was pretty upset about it. And 4 days later, I got a phone call. "Hey, my physical therapy's starting to work." Now, is that I don't know, is that considered a conversion Disorder? I don't know. Tension? Who the hell knows? But we're in the same ballpark, I think, in terms of mind-body medicine.
I do too. I do too. And if I didn't see you help people in that way so frequently and so consistently, I would probably even now write that off as coincidence. But I absolutely think there's a similar mechanism going on here where you're.
I've seen it many times. In fact, you know, everything, as with everything that you and I seem to talk about, depends how far down the rabbit hole you want to go. I read a book years ago called The Answer to Cancer. It was this hypnotist that claimed that all of cancer was a self-destruct program that kids got either during birth or very young. Now, I had a chance to work with a couple of cancer patients. I found it every time. It didn't change anything. Okay.
Hmm.
But I found it and I thought
What
that
did
was
you find? The trauma?
a self-destruct, some kind of self-destruct program. Either there was some kind of birth trauma, they had to do an episiotomy, I'm hurting mommy, or some kind of early trauma between the child, usually child and mother, where the mother was ill or somehow unavailable, and it became a self-destruct program. It was amazing. It didn't change the cancer, so I sort of stopped going down that road.
You know, maybe if you follow that line of thinking, maybe by the time it presents as cancer, it's obviously an advanced
Yeah.
sequela of a disrupted mind-body connection.
Well,
Whereas
you know,
if
and in my world, if you go down, you go down the rabbit hole, just about every physical complaint that people have, and I've tested this out on myself, will have an underpinning of some kind of emotional conflict. It, you know, and that's just because I live in that world. I'm looking for it all the time. I find that if I can hit the right note with it, people will heal faster physically. It doesn't mean that I can go like this, and if their leg was amputated, it grows back. Okay, that's we're not talking about that. But in terms of how do people heal, I'll give you a perfect example. My son, when he was a little boy, he broke his wrist. He fell off a bike. So every night, I would sit with him and have him visualize the bone healing. We had all kinds of games that we played, and he was brilliant at it. Well, his physician said, well, he'll have the cast on for 6 weeks. At 3 weeks, he said, wow, I've never seen anything like this. He doesn't need this cast anymore. That's mind-body medicine at a really, and I'm not saying that he had a conversion disorder. He broke his bone. But I
No,
think,
I think like your cancer example, I think conversion disorder is closer to an end state result of a trauma. You know, where do you want to begin? Let's start in 1944, right? In
okay.
Mattoon, Illinois, there was a woman who said a man was lurking outside her bedroom and sprayed something through the window. It left her and her daughter dizzy and nauseated. After that was reported in the town newspaper, which one of the features of conversion disorder is media actually makes it worse, which is important.
Mm-hmm, mm-hmm.
There were thousands of people that began reporting to police. It became such a widespread panic that it was known as the phantom anesthetist of Mattoon. All
I
right, that's
love it.
1944.
That should be a punk. That should be a punk band, I think.
It sounds good. Here's one, and the Tanganyika laughter epidemic of 1962. It's almost like a pseudo-bulbar affect, people spontaneously laughing, being unable to control their laughing, which is a sign of a neurologic illness, a neurologic damage, interestingly, or just listening to my hilariously funny jokes.
I like your jokes. I find
But
them.
you know, 14 schools, over 1,000 people were laughing inappropriately, hysterically, pseudobulbar. Again, it self-extinguished, no known cause or exposure in any of these people. Um,
I think we need
Similar.
to. I think we need to remember that Freud's original conceptualization, he called it hysteria.
Mhm.
He didn't call it conversion disorder. He called it hysteria. Now we
No,
have
conversion
massive,
disorder was a much later
much
coined
later.
term, probably the
But
60s.
so that's how what we're looking at is how hysteria turns into mass hysteria.
Yeah. Yeah, here's one from 1965 in England. A lot of girls. Again, it was in a school. A lot were fainting. 85 of them were rushed by ambulance to a hospital. They were swooning, moaning, chattering their teeth, tetanus. You and I have seen this. You know, we see this every day. Interestingly, Um, and again, no cause was ever exposed. Similar to Singapore, 1967, right? Um, this one's actually in. I don't know if it must be in the DSM. I know it was in the psychiatric literature because it became known as Koro, and you know what I'm talking about. The Chinese men have a irrational fear that their penises are shrinking, and if they continue to shrink all the way up, they will withdraw into their abdomen and they would die. Um, that sounds culturally specific. It was a very, very, very endemic concern in Singapore to the point that it is still listed in psychiatric manuals and known as Koro, K-O-R-O, which makes me think of like the Vikings we've talked about going berserk, or the Malay people with, running amok, where these terms come from. Ironically, were mass hysteric events. Now, I don't know anyone who uses Koro in colloquialism, but we do use run amok and go berserk still to this day.
We should.
Um, you just have you throw in some of your examples too, because I like, I'm sticking mostly to the last 50, 70 years.
Well, my examples tend to go more towards this phenomenon of groupthink. That the
All
idea,
right,
the
let's
idea.
let's save
You want to
let's save
save that
that.
one?
Let's
Because
let's evolve into that. 1974, Miami. Do you remember this? Everyone began itching. They had really bad pruritus, we call it, or formication, the feeling that bugs are crawling on you.
no.
They thought there was a poison. They looked for gas leaks, blah, blah, blah. It turns out it was probably triggered initially by one student who may or may not have been sick with the virus, but the symptoms spread throughout schools in both Barry, Alabama, I think it was, and Miami Beach, Florida. Miami Beach.
That one I can't tell you. I didn't know about that.
Yeah, no, that one I thought you might have remembered that. Do you remember
No, no.
Kosovo? Remember Kosovo in 1990 during the ethnic cleansing? The United States even got involved in that conflict.
Yes.
There were thousands of people that had this mysterious illness, thought was so chemical weapons. Again, every one of these examples, you could explain away as something else, but I only included them because they were, to the best of our technology and ability and understanding at that time, unable to identify any organic cause.
Yeah, there was in 1984, there was hundreds of Palestinian women and some Israeli female soldiers. It didn't affect the men who were fainting.
Mm-hmm.
They had a whole host of fainting that went on. It went on for a little while, and then it went away.
And, it makes me think of the Victoria women in the corsets. They were probably fainting because they couldn't breathe. But if you start seeing people drop everywhere, maybe that could have triggered a conversion. Maybe a portion of it was conversion. I know if I see somebody or anyone sees someone else vomit, you feel sick to your stomach. If I start talking about ants crawling on your skin, you're going to feel itchy. So is it power of suggestion? Is it hope, hypnosis? Is it groupthink? Is it mass hysteria? Is it conversion disorder? I think it's all the same spectrum of illness and intervention.
Well, we are looking at some real mind body stuff. I mean, and that's the sort of the foundation of just about everything I do, is looking at the interact. I would add spirit to that too, by the way. The core of the deeper work is always going to be around that. There are some people they come in, you say, essentially, cut it out. And they go, oh, that's right, I can cut it out. But there's almost invariably, what we haven't talked about, or maybe we have, I don't know, is that there's an unconscious component to this stuff. That they're not consciously doing it. There's an unconscious, I would say, some kind of unconscious conflict, something that is, they feel that is unacceptable, whether
Or
it's
unresolvable.
you mentioned sexual things. That very often is the case, but it could be other things as well. Parental conflicts that are. I saw a guy yesterday. He had his parents' conflict in his head. It was amazing. He had the whole conflict. It was causing him to behave. It was causing him. He was behaving in one person, almost like both his parents, and it had physiological symptoms. It had, and a lot of psychological symptoms. The bottom line is, he had no idea. When I said, hey, listen, you got your mother and your father in your head, he like looked at me like, what?
Yeah.
But that
I,
moment is
I don't want to get off
incredibly
topic,
powerful.
but I would love to know how you convince people of this in psychotherapy. You only have an hour with them. I mean, we're talking of weeks and weeks and weeks of talking about the mind body connection or non-ordinary consciousness as we understand it. Um,
They asked when I used to teach at the medical school, they asked one of the residents how I operated. He said he tells them jokes and then drops bombs on their head. I think that was a pretty close
yeah, but
description of how
you
I
get
work.
results out of it.
The thing, it's all about a connection. Look, you want to get the unconscious to be conscious. So I work with the body therapist. Sometimes it's in the body, sometimes it's just in the relationship. When somebody trusts you, they relax their guard. They say, yeah, by the way, this is what happened. Um, how things go in is how they come out, in my experience. That's why we usually learn these dysfunctional things in relationships. They have to be healed in relationships.
Yeah.
That's why I had another patient who cried and cried and cried and cried about things. I said, did you ever cry with anybody? She says, no. Well, no wonder it hasn't healed yet. You need to cry with people because that's how you got it in hurt in the first place.
Yeah,
You
well,
know,
the conflict and the trauma seems to be always present and like more clear and present, not like, oh, I have an unconscious desire to sleep with my father or mother or whatever. Um, it's like the Serbian and the Albanians. I mean, or look at us in Afghanistan and imagine these little kids growing up for 20 years now not knowing if the next second a Hellfire missile is going to come down. I mean, that kind of tension, I think, is the breeding ground for it to that energy has to come out in physical matter, and whether
and
that's in an illness itself, like
right.
cancer, or like you said, or a conversion. The Serbs blamed the Albanians for the entire outbreak as a false flag and trying to make them look bad.
Hmm.
Uh, and the Albanians thought it was the Serbs had been poisoning them, and it was a big mess because there were people falling down. They had headaches, they had dizziness. The rest you mentioned a lot of the symptoms, and we've studied that, and it's been commonly accepted that was definitely an example of conversion disorder. And I remember when that happened, but I think a more recent one were the anthrax. Remember in 2001, the anthrax outbreaks, and there were over 2,300, false claims that people had anthrax poisoning.
Now, admittedly, I was only 12 years old when this happened, but I had the great privilege of seeing the Beatles.
Oh yeah, okay.
Now, I watched people in the audience fainting, mostly women, fainting, crying. Um, when we talk about the early Beatles, when they weren't playing in big stadiums, they were playing in small theaters, and the ushers would be spraying eau de cologne on the seats because in the hysteria, the gals would urinate. So they would put eau de cologne on the seats. They called it eau de cologning.
That
The
happens
bottom,
to me though. When I listen to Pink Floyd, I pee myself a lot. So I
okay,
understand
well,
that one.
but that's okay with Pink Floyd.
Yeah, I don't do
That's not a disorder. You know, um, the bottom line is there are lots of examples that don't meet the diagnostic criteria, but from a colloquial point of view are really interesting to talk about. The War of the Worlds in 1939, when people thought there was a War of the Worlds, and they had all kinds of craziness that ensued from that. Um, we we live in a time of great hysteria because it's sort of we don't know what's true anymore. We don't know what
Yeah.
the facts are anymore. So, we will project onto things. And I think that, we could get away from this. We could talk about everything today is mass hysteria. We live in mass hysteria. But if we go back to the idea that there's a real psychological component that starts in conversion and that there are physical symptoms, not just psychological symptoms. Okay, we live in a fear environment right now. Everything
Yeah,
is.
and I'm surprised we're not seeing more of it. I mean, I mentioned Afghanistan. I do know, I think it was '09, there was an outbreak, and it was in a female school, as I
Mhm.
recall. Dizziness, fainting, vomiting, and it self-resolved, and it was proven not to be organic again. But a lot of people, I'm shocked, they don't remember the Leroy, New York outbreak in 2012. It was, and it
Wasn't that the
actually
high school kids with the ticks?
yeah, there were over 20. I think there was one or two males, but 20 people were infected with this outbreak, the psychogenic outbreak of again, Tourette's-like symptoms. You can go YouTube this really quick. You can look up those videos. You see these little girls, teenagers, grimacing and wincing and barking and grunting and very Tourette's-like. And every, I remember when the story first broke, and I'm like, hey, that's mass hysteria. But what happened? Weeks and weeks they were flying, the CDC, everyone was flying in, they were testing the air, the school, the water, the food. They tested everything. They tested all these kids, and the psychiatrists are like, hey, you morons, that's classic conversion disorder. And it got it, initially I think there was 12 girls, and then the media started reporting on it because it had gone up briefly and very acutely to 12, and then kind of stopped there. And then after the media reported, it went to 16, and then 18, and then started including some boys up until 20. And yeah, people were convinced there was a poison there. Now, is it possible it's a poison we couldn't detect? Sure, but this is classic conversion disorder and a modern example in our society. And there have been many, and there will be much more, I believe. I'm surprised the pandemic hasn't brought it out more. The only difference is we've been socially isolating, right?
It's coming.
So yeah, I
It'll
do believe it's
arrive. Don't
coming
worry.
too.
Don't
Um,
worry.
I read a thing that you remember the Havana syndrome, about that with the microwaves
Talking
making
about the where
U.S.
the
embassy
people in the
employees.
U.S. embassy were hearing things.
Yeah, there's a theory that that's actually a conversion disorder, but that's not totally been resolved yet because that technology exists. We know that it exists, and we're not the military. So this is probably very, very, very old technology. I would say in the 70s, it's just been weaponized and possibly used, but no one's ever been able to prove it. And it does have a lot of features of conversion-like illnesses. I think time will tell on that one. Or like you said, maybe that's more mass hysteria. Maybe it's an organic biologic cause. Um, there is another phenomenon to mass hysteria where you get the recurrence, which is really interesting. It's kind of a unique phenomenon. I think a modern example was in 2018 where there was a 9-year-old who developed crying and shouting, kind of again that pseudobulbar affect. All the kids, not all of them, I think there was 50 or something, but the kids in the classroom and that shared the similar, mostly female. Again, it was 4 or 5 to 1. Began with the exact same symptoms, like spontaneously resolved, but then it reoccurred at a later date.
You know,
So that's a unique
I
phenomenon.
wonder, and you're the details guy. I spent a lot of time in Lallaville, and you actually have some details and facts. But what occurs to me based on years and years of being in practice is that men are more likely to report chronic back pain that may be a conversion, technically a conversion symptom, rather than the ticks or glove anesthesia or some of the other things that we fainting. But the male version of hysteria or conversion would be chronic back pain, because I see it all the time in my male patients, and I had a little bit of it myself. So, which, by the way, when I
My
figured
back
out
is suddenly starting to hurt right now.
well, you should get a better chair, Mark.
Huh.
The no, what I found was when I dealt with the emotion that was underpinning my back pain, then some of the physical things that I was being told to do started to work, much like the tennis player. Um, when I figured out how many knives I had in my back, which was the therapist said, well, who stuck a knife in your back? Um, all of a sudden, all the good physical things that I had been told to do, the stretching and then all that, the strengthening. Well, gee, all of a sudden it began to work. Duh. And if we look at the mind body stuff from the point of view that the emotional stuff will block some of the good healing things that we know should work, now we got a ball game in my world. I don't expect that if I can get to your unconscious stuff, that you don't do anything, and your body, you got to now do the work that allows your body to heal.
But yeah, it'd be helpful to recognize this ahead of time. I guess that's why we're doing the show.
Yeah.
Really got me thinking about the pandemic. I know right before the pandemic, there was an outbreak, I guess, in Malaysia. I think it was. Again, it was at a school. It was at a girls' school again. But this one was kind of interesting because it involves like the cultural beliefs of the time. Again, like, Middle Ages, they would have thought something else was causing it versus the 1700s versus, and still, I mean, at the time, this is 2019, right before the pandemic started. These kids were like falling into these trance-like states, almost like a catatonia or coma, and they many had claimed that they saw the face of pure evil in visions while they were converting. They
Well,
would
if you think
scream.
about it, in Italy, when the upper respiratory stuff started and they didn't have hospital beds and doctors were freaking out and they couldn't treat it, and there was this incredible hysteria around it. That was in 2017. That was the flu. Okay. But nobody kind of locked down anything. There were no masks. And it was the same scenario there that we had years later. Could it be that media is involved in some of this?
Definitely.
We have.
Studies have actually proven that the exposure to media exacerbates the illness. Similar to reporting suicides, like people who
Right.
jump off the skyway. They're I don't know if it's still a law, but they do not publish that in the paper because guess what? After they do that, they more people get the idea. So is that suggestion, access to information? That's something that is really, it's the opposite phenomenon of not having a frame of reference.
Well,
So
but if you think about it, suggestion does play into some of this. I mean, we were talking about Ernest Hilgard out of Stanford, who's a hypnotist, actually a psychologist. What they did was they had a blind person in the class. They were playing with hypnosis, and they said, "Well, can you make him deaf too?" Well, he was a good hypnotic subject. They had a signal where they touch him and he'd come out of trance. So he hypnotized him, and they're banging pots and pans, and the guy's acting like there's no noise. Somebody says, "Hey, wait a minute, he's not really deaf. Is there a part of him that can hear this?" Hilgard thought that was a great idea. He said, "If a part of you can hear me, raise the index finger of your right hand," and that's what you get. They interviewed the young man later, and they said, "Well, what was it like?" He said, "It got real quiet, and I was doing a math problem in my head. All of a sudden, I was wondering what you guys were doing, because I had the inexplicable urge to raise the index finger of my right hand." Hilgard came up with the idea of something called the hidden observer. And it begs the question, it begs the question of how deep do we go in the emotional connection to physical manifestation of illness. I know in my work with Samantha Haynes, we always look up possible emotional underpinning whenever somebody has a physical symptom. Even like when I tore up my knee, okay, the knee, two bones in the lower leg, one bone in the upper leg. The knee is the connector between duality and unity of experience. It was exactly where I was when I tore up my knee, is coping with that. Is that a coincidence? I don't
but
know.
see, this, so you're more likely to see it. Kind of like when media reports it, it's more likely to exacerbate a problem. Have you
Oh
heard
yeah,
the
I'm talking
adage?
about it from a treatment point of view, of course.
Yeah, but there's a fundamental understanding or at least belief. Like, have you heard of the adage that um, the when Columbus broke the horizon to the New World, that the Native Americans could not see the ships
Yes,
because
I have
they
read
have
about that.
never seen ships before in their life. So they're literally, their brain didn't know how to process that
Yeah.
there are people on them. They're in a wooden boat and they're approaching us. And basically, they didn't see them until they landed, jumped off the boat, and it was within a frame of reference, like, whoa, this is a humanoid like us, and you know that kind of thing. So one of the things that fascinates me is nobody thinks about conversion disorder. People don't remember these stories, and I've often wondered why. They're very memorable to me. They're very concerning. They make an indelible mark on societies throughout time. How come, like even near death experiences most people have heard of, even though they haven't had one? Is there a phenomenon that people don't know, recognize? Maybe if we were all more aware of conversion or that mind body connection, we would have more control over the intervention and prevention of these outbreaks.
Well, funny you should mention it, because as I was going through the material, there's this thing called groupthink, which stifles dissent. It stifles any kind of other experience that people might have. Now, the way it comes out is not in a physical symptom. It'll come out in, for example, reactions to 9/11, um, Bay of Pigs. Bad political decisions are made out of groupthink.
And the
And that's how it's
daycare.
usually connected to.
Remember the whole sex abuse hysteria around the daycare?
Oh,
That was
yeah, yeah.
another example. Uh, herd mentality, mob mentality, sports psychology.
Well, that's kind of what, it's kind of where we're going, because when you mass hysteria, probably in its purest form, are like political rallies, and creating demigods out of political figures, or even rock stars, like we talked about the Beatles before. It's an amazing phenomenon, but it's at the underpinning of just about everything I do in my work, is looking at, okay, well, what's really going on here? Um, that's why I always want people to look at their nutrition. I mean, can your body support healthy emotions? I mean, I know we're off the conversion, but not completely.
Well, it involves neuromodulation and your immune system and sleep wake cycle. It kind of reverberates through our entire being.
Which is
Um,
why I think that the conversion stuff is so important, because it is a clean example that you cannot refute of mind-body medicine.
yep. That's why we did the show,
I know, that's why we did the show. It was a cool show, man.
It's good stuff.
I liked it. I like looking up the stuff too. It was fun.
Yeah, and I mean, certainly these outbreaks will continue. That's a guarantee. I do think they will increase. I'm surprised that they haven't. They may when people start returning back to their normal lives, and the still stress and pressure is there. But hopefully we're quicker to recognize it, identify it. Certainly in the beginning, obviously you have to rule everything out. So there's a lot of confusion with bioterrorism and infectious or toxic exposures and all these other causes, but ultimately we always have to have that in mind, and make sure that we have these environments where people feel safe, so that the Catholic schoolgirls aren't the highest risk.
Well, but I mean, if you start to add in environmental factors, that people are eating genetically modified food, that the air has glyphosate in it, from because it's water soluble, and that we're breathing this stuff, it changes our ability to deal with stress, to deal with trauma. Um, you wonder why some soldiers, if you take the example of shell shock in World War I versus what we had in Vietnam.
Mm-hmm.
Well, the Vietnam soldier was 19. World War I, they were 26. They're different.
Yeah, that's more age protective.
Yeah. So we're looking at many factors, but I think the most important thing, and this is probably a good place for us to start wrapping up, is the idea that the more we understand this, the better we can provide for people who are hurting, whether that hurt is a physical pain or a tick um, or anxiety, whatever it is. We want to be able to resolve these things so people can be happy, healthy, and live productive lives.
Well,
And I think that using this as an example, Using this as an example of how things work makes it real clear that this isn't just something that I cooked up in my hippie days, which I don't think have ended, by the way.
Old hippies
So,
never die; they just flash back.
what if I never took acid? Is that a flash forward?
I concur.
Ah, yes. Tune in next time.
Yeah, hopefully next week we get Dr. Kate Wilson.
Ooh, that would be good.
We'll have a guest on
I
our
can't
show.
bring this guy out then. That wouldn't be fair.
And we're going to further elucidate this concept of where are we consciously, how have we changed in terms of, since the 50s, and like you said, food, crops, medicines, how they've integrated into our society, and how possibly they might be affecting our bodies, minds, and spirit. She is a fascinating person, and looking forward to having her on as a guest. And from what I understand, so is Captain Picard. Indeed.
Make it so, number one.
So I guess until next week, right? We got to make sure you be well.
Be well. Ah, that was
close. I think another 50 so weeks, we got it.